cars from the Rath Building with the Erie County Department of Health Commissioner, Dr. Gail Burstein, as we give an update today on the COVID-19 outbreak in our region. I want to thank everybody for all their good work these last few days of following the rules and regulations that exist to ensure that we're protecting the public's health. There was a lot of trepidation at first, but it seems like most people are understanding the situation today, the seriousness of it, and I want to thank you for doing that. We've got tremendous staff that are working very hard on behalf of the public, but I also want to thank the public for the good work that you're doing. There are certain rules that are in place to protect the public's health, and we're asking everyone, of course, to follow those rules. You've been following them most of the time. We had a little issue at the beginning, including with some of the bar scene, but now the bars are closed. Restaurants are closed except for takeout. We know that barber shops and beauty salons are closed, and of course, after 8 p.m. tonight, all major malls will be closed, as well as some other aspects, including businesses that have to shut down if from their workplaces, though individuals can actually work at home. So the workforce does have to be restricted from their workplace for all non-essential businesses, as has been determined by New York State. As always, the information that is being provided is as valid as it was when we put the information in our PowerPoint presentation and received it. The situation is fluid. It changes daily. There's information that we provided previously regarding cases in towns that when we did further digging, we found out the individuals actually didn't live in the community we said they did. They lived in the one next door. That happened earlier today. 2 cases that were identified previously as City of Buffalo. One was the City of Lackawanna, and the other one was the town of Tonawanda. So we want people to understand that it's a fluid situation, and as we develop more information from the patients and their families, we often find out that some of the original information might have been incorrect. That's why we're constantly updating, and we want people to understand that this information is very fluid. So, of course, you are going to hear from myself, but you're also going to hear from our Commissioner of Health, Dr. Gail Burstein, and I will turn that over to her now.
Thank you. So just want to give an updated on the testing numbers. So as of today at 1:30 p.m., we had a report of 57 laboratory confirmed positive cases among Erie County residents, and that's including all the labs, not just the public health lab. So that also includes Quest, LabCorp, Wadsworth, and the CDC lab. There are, so far from our Erie County Public Health Lab, there were 318 negative results among Erie County residents. There were 190 pending results among Erie County residents. So far there are 565 tests that were completed or pending among Erie County residents by the Erie County Public Health Laboratory. So just, a little bit of information about the positive cases. They are residents of most of our towns and villages and cities in Erie County, a wide range of ages. We have 11 confirmed positive cases that are hospitalized as of today, and 3 of those are in the intensive care unit. So we are seeing a higher level of acuity as the disease epidemic progresses in our community. So as of today at 2:30 p.m., there were 57 people who we are holding in isolation. There are 147 people who've completed quarantine, and we're currently following, 174 people who completed quarantine, and there are currently 193 people who are current contacts. 293 people that
switch
are.
Glasses?
No, I got it.
No, we shouldn't switch glasses.
293 people who are currently following as contacts in quarantine. So we assume that COVID-19 is in throughout our community, and that everybody who's watching may have been exposed because it's just so prevalent in our community. And so, that's why we have really not put together any additional public notifications, because it's really a gross underestimate of the risk in our community. I think we can safely assume that anywhere we leave our house, anywhere we go outside our house, anytime we leave our house, we could potentially come in contact with somebody who is COVID-19 positive. So, people just have to act accordingly and just assume that anywhere you go outside in the community, outside your house, and maybe even inside your house, there is going to be COVID-19 present. So you don't need to call our public information line for information about where those public exposures are. You just have to assume that they're everywhere in our community. So, and then, we really want, even the health department and the entire community to really prioritize monitoring of our susceptible individuals. So those are people in the healthcare settings, people working in the hospital, people as patients in the hospitals, and people working in other medical facilities. They're really precious to us now, because we know there are a lot of people that are ill right now, and there are going to be even more people who are going to become very ill. So we have to pay attention to those people working in our healthcare facilities. Also, our family members and close contacts, we know that those have high risks of exposures, so that we know that they're likely to become positive in the near future. And then also people who are seniors and people who have chronic conditions, we know they can become very, very ill. So it's really important that people around them and people that fit in these categories make sure that these individuals are monitored, so checking the temperature and looking for symptoms of cough and shortness of breath. So just to help Erie County residents get an idea of where we're seeing cases, we have an interactive, what we call a heat map, looking at positive cases displayed by the municipalities. So these are updated regularly. It was smartly designed by the Department of Environment and Planning's GIS division. So I just want to just reinforce that these are cases that we know of. They've been tested and they've been reported to us, but these are really not just the only people that have COVID-19 in Erie County. So I don't want people to get a false sense of security by looking at the numbers of this map. The true numbers are much, much greater. We just haven't tested everybody. So I just want to talk about self-monitoring, what that looks like. So what we're asking people that we're following in quarantine and isolation, and then people who we're not following, even those individuals should be monitoring themselves for symptoms. And so that means checking for fever of 100.4 daily, a cough, or shortness of breath. So you need a fever of 104 degrees daily and cough or shortness of breath. So if you develop any of those symptoms, you want to make sure that you isolate yourself at home and from others in your household. And then you may call your physician if you start to feel uncomfortable, that dehydration or difficulty breathing. Don't go directly to their offices. If you need to contact your healthcare provider or go to the emergency department or an urgent care center, call first. We warn them that you're coming, and so that they can be prepared to handle you if you do need to come. Many times when you have medical concerns, those can be managed over the phone with a healthcare provider can give some good advice. So, if you think you need to talk to a healthcare provider, call first. Just don't show up. So, we have some great information about not just medical resources, but also mental health care resources. We know just being cooped up all day is and not being able to physically be near people that you're very close to and that you love can be very, very stressful. We appreciate that. We're all dealing with that too. So we just want to give you some great resources about information for mental health services. So on the screen, there's a website has great information around a lot of different resources in our community for health, mental health, and any type of health-related services. We also are working with our School of Public Health, School of Medicine, and the School of Nursing, and we're also working with PPE manufacturers. However, if you are any of these people, if you have any type of experience in healthcare, if you have any experience with public health, even if you're just a student, or you have any information about personal protective equipment, we really need you to reach out to us and let us know that you're there and you're willing to help us. A number that you can call to give us that resource is 716-858-2300. Again, it's 716-858-2300 for Erie County. Again, the state and the county has great resources on our website that we want people to take advantage of.
Thank you, Doc. Yesterday in the morning, I tweeted out a picture which was talking about safe and social distancing, physical distancing. We had a little fun to try to get a message out. For those of you who know my press secretary, Peter Anderson, he has a collection of WWF wrestling figures from the 1980s, and he always has a little display in his office, which the local media gets a good chuckle out of, so we thought we'd have a little fun with it. And it turned out to be the most liked and retweeted tweet I've done in probably years. So it's a good thing we did it, because it's getting out the message. That's a Royal Rumble, folks. You can see Macho Man flexing his muscles up front, Classy Freddie Blassie talking to the crowd, George Animal Steel, nobody wants to touch George, Big John Studs getting double teamed. Everyone's in there. This is not safe social physical distancing. You want to stay home, you want to stay spread, stop the spread, stop the lives. And then we also included another picture to show what is safe social distancing. If you ever watched the Royal Rumble and you knew in the 80s, you knew it generally came down to Hulk Hogan and Andre the Giant. And there's the Hulkster and Andre the Giant in their respective corners practicing safe social distancing. Now, this is silly. It's goofy. But it helps get the message out about what is safe social distancing. Going out and hanging out with your friends that you haven't seen in a few weeks is not safe social distancing. Being with your family members, going to a park with your family members, that's okay. Getting out there and being with the people that you're always with is okay, but coming in contact with people you haven't been around, these individuals may have COVID-19. As the doctor noted, we expect COVID-19 to be in every community right now, and just because you might not see it on our interactive map in your town doesn't mean it's not there. And you have to assume you've actually come in contact with somebody over the last few weeks. And I'm saying weeks, not just days, because we believe, based on the information that we received from individuals who have COVID-19, that COVID-19's been in Erie County and probably Western New York for a number of weeks now. Now, had a little fun with the wrestling action figures. I want to give a shout out to Richard Durwald from our Senior Services Department, our Mr. Fitness, who's a former professional wrestler. Richard's a lot older than I am, but he's in a lot better shape than I am. So Richard, who's friends with some of those guys, hi to Richard at home. Just to remind everybody regarding mental health, this is a stressful time for everyone. Anxiety is normal. You are not alone. There are a lot of people who are concerned, and it's understandable, and it's normal. If you weren't concerned a little, I think there'd be questions as to whether or not you're taking this seriously. But if people are taking this seriously, they should have some concerns. We want you to know that this is a marathon, not a sprint. This is not going to end in a few days. There are projections that by the time we get through everything with COVID-19, it's going to be months. We may be able to come out of the situation we're in right now in weeks with regards to the quarantines and the work environments being closed. But before we really feel comfortable that a vaccine's in place and that everyone has at least come in contact with the illness, it's going to be months. So we want other people to realize this is a marathon. It's not a sprint. We're not going to be able to come up here next week and say, it's over, you can go back to your normal business. I want to be truthful. I think the public deserves to know the truth. Anyone who's saying that, oh, well, things will be normal in a week or two, that's not correct. We know it's going to take some time. Just from looking at pandemics elsewhere, and how this one was addressed in China and in other places that got it a lot earlier than we did. You got to find healthy ways to relax, walks and fresh air, get out there. Spring is coming. I'm happy when I come home. I can actually see my daffodils and my tulips are sprouting. They're popping up. That actually makes me smile because we know life in spring is returning. So we want people to ensure that you get out there, reach out to your family, friends, and neighbors. If you can't do it in person because of the safe physical distancing we want people to do, we still want you to connect with each other. Connect through social media. Connect on the phone. Everybody, probably, well, not everybody, but I put a little video out last night regarding playing a song for my friends, because usually when I'm at events or little parties, house parties, I'll pick up the guitar and sing a song. Well, I'm not going to be able to do that for a while because I don't think I'm going to be able to attend a house party, or any of us a house party, for a while. So I put a little video out of me singing a song to connect with my friends, and that seemed pretty popular with other people too. Don't distance yourself socially. Distance yourself physically. We want you to continue to have contact with your friends, your family members. And if you need help, don't be afraid to ask for help from your family members. Our crisis service hotline is 834-3131. So if you're really concerned, you're really stressed, you're not knowing what to do, to turn, you're thinking some bad thoughts, don't take that final action, folks. Call 834-3131, and you'll talk to a trained professional who will help you see that there is hope and better days are coming. And we want to ensure that this is something that everybody does if you are feeling that exceptional stress level. The COVID-19 call center, as we've noted, it is open, 858-2929. It's open from 8 a.m. to 8 p.m. daily. This is to be called for real calls and real situations today. It's not for hypotheticals. There's lots of information that you can get online from various resources, including our coronavirus page, the federal coronavirus page, if you've got specific questions that are more hypotheticals. If you have a legitimate question with regards to issues associated with your health, you should always call your doctor first. If you're feeling sick, you should call your doctor first. You should never go into work, and there are still personnel that are essential if you're feeling sick. We know of at least one case where an individual was feeling sick, went into their workplace, exposed other people in their workplace to their illness, then left, was tested and found to be positive. And we know that the other individuals now have to be in quarantine because they've been exposed from the individual who went into work knowing about what was going on with COVID-19, feeling ill, and now have exposed others. So please don't do that. If you have specific questions that need to be asked or answered by a health professional, you should always contact your doctor. You can call us at 858-2929, but please don't call us for hypotheticals. Once again, it's so important. We got it on 2 slides in a row, just so people remember that there are lots of resources out there online that you can check to review the issues associated with the coronavirus. We have an English language page, of course. We also have a Spanish language page from Erie County Government, and we do know that other resources are available for other languages right now. WinCosh is actually got resources through the International Institute in many different languages, so if people speak other languages and they don't know where to turn, and they may be a friend or neighbors of yours, you can let them know that there's other resources out there. So we want people to understand that there's opportunity to get accurate resources. Let me just make a little change here. Pop out of that and go here. Once again to our COVID map. This is the latest information. We are hoping that in the next day or so that we'll actually be able to put a recovered on the page. We think some of the individuals who were originally afflicted with COVID-19 in the first tests actually may be getting very close to recovery or potential recovery. I'll let the doc talk a little bit more about how recovery is determined.
Well, the recovery is really determined clinically since we don't have the capabilities to do additional testing. So when we see that somebody has been fever-free for at least 3 days, and their other symptoms are improving, and it's been over 7 days since the symptoms have started, then we will determine that the person is basically recovering. If they're somebody who is working, that point that they can return to work. But again, we want to make sure that it's been at least 7 days since the onset of symptoms, and we want to make sure it's been at least 3 days since the person has stopped having a fever. And then the other symptoms are getting better during that time. So again, we really want to make sure that people are fever-free and really on the mend before we determine that they've recovered from COVID-19.
Thank you, Doctor. As you can see from the map behind me, it's pretty much across all of Erie County. We also know that there are cases in Niagara County, there are cases in Wyoming County, there's cases in Allegheny County. You should once again go under the assumption it's everywhere in Western New York. It's everywhere across our community, and you should be taking this seriously. We've seen stories about spring breakers partying down south. That's horrible. That's terrible. They're probably exposing themselves, and as we've seen recently, there's some really tragic stories of young people out of Italy that are dying. They're being put on ventilators. So just because you're young does not mean that you are immune. Nobody is immune to this. This is a virus. The virus does not discriminate based on your sex, based on your race, based on your net worth, based on your location. It's spread across the entire world. So if you think you're immune, you're not. And as we know, we actually have cases of individuals in Erie County where individuals are in their late teens and 20s. So just because you're young and maybe in the best shape of your life, except for Richard Durwald, who's in great shape no matter how old he is, and he's in his 80s, you're susceptible. No one's immune to it. With that, we'll open it up to some questions from the members of the media. So let's make sure the line is open. Line is open. We will start from the bottom this time because we started from the top last time. So if you're, I will call out the media outlets. If you can mute your phones on your side until such time as I call you out, I'd appreciate it. We don't need to hear a lot of the background from your. So the first, if they're there, is the Associated Press. Do we have anybody from Western New York Media? Do we have anybody from the B newspaper group? Do we have anybody from Buffalo Business First? Mike Baggerman from the WBEN.
Hi, Mark. First of all, I want to give a shout out to Peter Anderson for those wrestling figures. Good little move there. Regarding testing, I want to get an understanding as to why Erie County has such few testing capabilities compared to other counties across the state, such as Albany County.
Albany is utilizing the Wadsworth Lab. Albany it does not have a separate public health lab. They are utilizing the New York State lab, and I believe they're getting. If you could mute your phones if you're not on, otherwise we'll have to mute you all. Okay. The question was, why does it appear that other counties in upstate New York have received more test kits? We believe some of the counties in Ulster, Dutchess, Albany, Rensselaer, because they rely on the state lab for testing, have been able to do more tests. We're told that we were going to be the primary lab for Western New York, so we were receiving our test kits from Albany. After receiving the initial batch from the CDC, they have provided us more. I was on the phone yesterday with my contact in the governor's office, who basically is the controlling the kits and their distribution. And we've had multiple conversations over the last few days. We are getting more test kits. We're hoping for a large batch actually to come in as well on Tuesday. We don't know exactly how much we're going to get until we get the actual shipment. As everyone knows, test kits are very, very in short supply across the country. Private labs like Quest are doing testing, but they have limitations on how they get the swabs. Doctor, would you like to talk about that?
Sure. So the people at working at Quest Laboratories are not going to collect swabs on individuals in the community. They've sent out notifications to healthcare providers and to the public that they don't have the appropriate N95 and other masks and personal protective equipment among their staff in the Quest laboratories that are collecting specimens. So they're not going to be able to collect the specimens. So it's really relying on community providers to collect those specimens. And as we know that there is a shortage of the viral specimen collection kits that we can use to collect the appropriate specimens. And there's also a shortage of the N95 masks and other personal protective equipment for community providers to collect these specimens. So we're, our hands are tied. We have to wait for more laboratory resources to be able to do more testing.
Thank you. Next question goes to Sandra Tan from the Buffalo News. And once again, could the rest of you please mute your phones?
Just to follow up on the testing capacity, I was following the governor's press conference this morning, and it looks as if Monroe County has 902 tests completed, which would be several hundred more than Erie County has had completed. And I'm wondering why Erie County has such a low number of completed tests when we have our public health lab here, and Monroe County has so many more.
Doctor?
Yeah, I mean, again, it's really a function of, getting the specimen collection kits, the nasopharyngeal specimen collection kits, to be able to collect the specimens in the nose. So for some reason, Monroe County had more resources than we received in Erie County. And also, just in terms of our public health lab, we've been doing the lab tests for and not only Erie County, but also other surrounding counties too, and also the other surrounding counties are able to send their laboratory specimens to Wadsworth. So, again, our hands are tied right now because of our ability to collect new specimens. And again, whatever those numbers are, even if we could do more tests, it wouldn't give us any more information. We know that the virus is very prevalent here. We know that there are many, many people that are infected, and we know that it's really in all of Erie County. There's no place that is safe. So, again, the numbers are important. And there's one piece of information, and I think that we really shouldn't focus on the numbers. Right now, we have to focus on how we can protect ourselves and how we can protect the rest of our community by physical distancing, social distancing, washing our hands, practicing appropriate respiratory etiquette, and keeping our environment clean, especially frequently touched surfaces. That's what we really have to focus on. The numbers are important. But what's going to save lives and prevent people from getting sick is taking the appropriate actions that we've been recommending.
Okay, thank you. The next question is to Allie Tui. Everybody gets one, and we'll continue to work through. Allie Tui of WKBW Television. Allie, are you there? Maybe you've muted yourself? Allie, are you there?
I am here. Thanks for taking my questions here. No? Can you hear me?
We can hear you. Go ahead.
Okay. Sorry about that. What is the status of drive-through testing locations here? I know, to point out Monroe County again, they already have some up and running. Are you guys in contact with hospitals or other healthcare providers where that might be an option? What's the status there?
It will be an option when we get more specimen collection kits. And we have been, we have sites that are ready to go. We have staff that are ready to work there, and we have the appropriate personal protective equipment to, to be able to protect our staff collecting the specimens. And I know that Catholic Health had been offering one of these drive-through specimen collection clinics themselves. However, we're all out of enough of these viral specimen collection kits to be able to offer these community-run clinics. So I know that's disappointing. I know people are anxious to know their status and get tested. And I also know that it's very prevalent in the community. And again, we can't just focus on the numbers, and we just can't focus on the testing. We have to focus on what we can do, in our homes, in our community, at the workplace, if you're still going to work, keep ourselves healthy and to keep the people around us healthy. That's what we have to focus on.
Thank you. Next question to News 4 Buffalo, WIVB, Sarah Minkowitz. Sarah?
Yeah, hi. So several people have been reaching out to us about places like like Home Depot and Lowe's being, packed with people buying things like paint, gardening equipment, basically things to keep themselves busy but aren't really essential, and workers are getting concerned about this. Is this something you guys are looking into and would possibly regulate?
New York State has determined in order that these types of home goods retailers are considered essential. We do need to keep them open because there are supplies that have to be purchased. Even the county purchases supplies from Home Depot. So what people are doing otherwise, we're asking people to be smart about it. But these companies like Home Depot, Lowe's, I don't think there's any other real large ones in this area, but there's lots of other smaller family-run organizations that actually provide these types of home supplies, especially for contractors, are necessary because if someone's roof needs to be fixed, you need to be able to get the shingles for the roof and actually be able to purchase it. So there are certain things that the New York State has determined is essential. We're trying to, as part of that, remind people even if the business is essential, we still want you practicing safe physical distancing from each other, and that's about all I can add with regards to that. WGRZ, Channel 2, we'll start with Steve Brown, and then when we come back the second time, Leanne, you'll have an opportunity to ask a question. Steve?
Hey, actually, Mark, Leanne's closer to a deadline, so she's going to take the first question if you don't mind.
That's fine. Go ahead, Leanne.
Hi, Dr. Burstein. Mr. Poloncarz, my question is regards to state resources. Yesterday, the governor announced that New York State would be purchasing 6,000 new ventilators. They'd be making their own masks. Is Erie County going to be seeing any of these extra resources, or are these going to be going to the most critical areas like New York City and other parts of the state? Have you heard anything about Erie County getting any of those extra resources?
Yes, and I actually was in contact yesterday with a high-ranking member of the governor's staff requesting our priority list. And so from our emergency services department, our Department of Health, and the sheriff's office, we provided them a priority list of the things that we would like ASAP. It's not surprising. It's some of the same things that people have heard about with our regards to masks, gowns, not only just testing kits, also thermometers so we can measure individuals in the jail, as well as we move forward, people who enter our county buildings, because we don't want people coming into the county buildings if they are above a certain temperature. So yes, we have been advised we would be getting a portion of that. How much, I can't answer that question, but we've already worked on it. The doctor with her staff yesterday put together a fairly comprehensive list of the high priority items. Not everything we'd want, but the stuff we truly would like to have if we could get our hands on it during this week. Going back then, next round of questions, starting again. Anybody from the Associated Press, Western New York Media, B Newspapers, Business First? If not, Mike Baggerman, WBEN Radio.
Hi, Mark. The governor earlier today said that this could go on for 9 months. Is that the projected outlook that you guys in Erie County are looking at too, as many as 9 months?
Well, it depends on what you talk about. It's possible it could go longer before we have a vaccine. We don't know how long it will be before we have to end some of these quarantines and the closures of non-essential businesses. We're assuming that is weeks. We've been hearing from the health professionals, not only locally, but we've been getting reports and modeling from other organizations, international as well as national. They're talking about a spike being, in our region, still being about 40 days away, and then it going back down, probably going down for the summer, as you often see with viruses and viral infections, and then potentially picking back up in the fall. So I'm not surprised the governor would say that. We know that this is a long slog. As we said, it's a marathon. And if people are looking for an answer to say that this is going to end next week or the first week of May, I wish I could give them that answer, but I can't. Next question, back to Sandra Tan. Oh, first off, anybody from WBFO on? I don't think so. If not, Sandra Tan.
Okay. To clarify on my last question, I know that we should assume that COVID-19 is everywhere, but in fact, the governor has said that the state is doing more testing than anyone because they very much believe that it's important to helping to stop the spread. of the illness because you can, quarantine more people if you know that there are people around them who have tested positive. So I was interested in just getting some more clarification on the whole issue of whether or not, more testing is important. Secondly, the parks are like super crowded right now, even though the parks themselves are very large. The parking lots are really crammed full of cars. And I'm wondering whether there's any effort being made to kind of help spread all that out.
I'll handle the parks question. I was just in contact with Troy Schinzel, our park superintendent, and we have heard that Chestnut Ridge, once again, is very busy, and many of our other parks have nobody there. Folks, we have 10,000 acres to enjoy. We got great parks in Emory, Sprague Brook. We have incredible natural wildlife areas with hundreds of acres, like our forest, Franklin Gulf, Rademacher Park. In the North Towns, of course, we have Ellicott Creek, we have Akron Falls, we have a lot of pocket parks in the city of Buffalo. What we're seeing is a lot of people are going to the big parks, Chestnut Ridge and in the city of Delaware, when there's lots of other parks to enjoy. Just don't go to one or two parks. Get out. A lot of people know that we have our park ranger program, and as part of that, we did the little parks passport, in which people were encouraged to go to different parks, and that's what we're asking you to do, is to go to different parks. Don't go to the same park. Explore a different park. I do not want to have to shut down Chestnut Ridge because too many people are going there, and you are not practicing smart physical distancing. We want people to understand that that's a concern. But the thing is, as you know, there are some that are very busy, and there's others that are just as beautiful and almost as large as Chestnut Ridge, and nobody's there. Go to our website, erie.gov/parks. Check out the listing of the parks. And if you want to go to a park, don't go to the one that lots of people are probably going to go. Go to a different one. Experiment. Go find some different ones to enjoy. And then I'll let the doctor finish the first part of that question.
Well, Sandy, I think we all agree that testing is a component of our prevention strategy. Unfortunately, for reasons that are out of our control, we can't do any additional testing right now. Our public health lab is working on running tests on the specimens that we've already collected, and we have enough reagent to finish that. And we expect to finish up completing those the tests on the specimens we have sometime Tuesday. However, again, we don't have access to more testing. However, we still have access to doing whatever we need to do with our non-pharmaceutical interventions. And I think in the absence of testing, I think we all have to assume that there's a good chance we could have been in contact with someone who has COVID-19, and so take the appropriate actions of staying away from other people, self-monitoring, checking your temperature, checking for cough or shortness of breath. And even if people are able to go to work, if they're considered working in an essential function, they should just go to work and go home and stay quarantined. Go to work and go and stay home quarantined. I mean, that's really what we're recommending is people hunker down, stay away from everybody, and keep things clean. Try to wash up the virus where you can as much as possible. Just because we don't have the tests doesn't mean that we can't figure out what to do to protect ourselves and to protect people in the community.
And if I can add, it's not like we're not trying to get the test. We are working very hard, not only from New York State, but other resources. I've been in contact with a number of individuals in the last few days that have offered to try to get us tests from other sources, including the new 45-minute test, where you can test it within 45 minutes you'll have an answer from Cepheid, which was just approved yesterday by the FDA. I mean, this test didn't even exist in the U.S. as a viable test and was just approved by the FDA yesterday. We have individuals that we are in close contact with that are trying to get millions of dollars of worth of that test to our community, but they're finding out that there's going to be limitations on it. So even though we're working all of the resources possible, everyone's in the same boat. There's limitations on it. Now, there's a lot of questions as to why New York City got more. Well, New York City's bigger, and it also had the outbreak first. So New York City and Westchester County were having cases before we were even reporting cases. As noted, our first batch came in from the CDC. We've gotten additional test kits, and we're working on the reagents as well from New York State. But if we had been the first outbreak, I'm fairly confident we would have gotten a lot more to begin with, but because we weren't, all of that was going to our friends downstate who have hundreds to thousands of more cases. I think there were over 2,800 new cases identified in the last 24 hours in New York City alone. So and we're at 57. Yes, if we could test, we would identify more, but because of our density and our population, we're 925,000 or so as compared to 13 million in New York City. So I do understand why they were checking in New York City first, because if it gets out of control in New York City, it's going to be very out of control. And they're exceptionally worried about the impact associated with that. Allie Tui from Channel 7.
Yeah, in regards to PPE equipment and making masks, is that something that you all advise? And do you have any guidance for groups or individuals who have the capability to make these masks or sew them?
The only thing I read is that there are limitations on what would be really a usable mask. We've heard of a lot of organizations that want to transition from what they have into a mask, and we're not saying don't do that, but it may not qualify as an N95 mask because the N95 mask has to have certain requirements associated with it. And remember, the mask is primarily for individuals who are ill or those that are in a healthcare facility. We don't think the average person wearing a mask is going to make a difference if you don't have the illness. We're trying to get these supplies. And one of the number of the things that we put into that high priority list in New York State were not only the masks, but also other PPE equipment like face shields, more gloves, more gowns. As we said, it's going to be a long slog, so we're fully expecting that in the long run we will get this, but we're trying to get as much as we can in the short run so we can help our those who are directly at risk, which are the health department folks, as well as the individuals that are in healthcare organizations, like hospitals, like urgent cares, like nursing homes. None of us are happy with the situation we're in. I was talking to a healthcare provider yesterday, or maybe it was even this morning, and they talked about, because the days are really long, folks, so sometimes you lose track of what hour it is. But I was talking to a healthcare professional who said that they were able to acquire and purchase a number of masks at basically 8 times the normal price. But they decided to go ahead and move and purchase those because they were able to get a manufacturer who could ship them out right away. It's a really tough situation, and I certainly feel for the healthcare professionals out there that are on the front lines dealing with it. We're busy here, but we're not on the front lines like the other people, and I want to thank all those people on the front lines for the work they're doing. I don't think I said it earlier, but is anybody on the line from Spectrum News? I don't think so. If not, Sarah from News 4 Buffalo.
Hi. You guys said earlier you have 190 pending results or tests. When do you guys expect those results to be completed?
We're hoping that all the test results will be completed by sometime on Tuesday. I mean, that's what we're aiming for. Is at the current pace of where we're able to complete these laboratory tests in the lab. We anticipate sometime Tuesday we'll have completed all of the testing on all the specimens that we currently have.
Channel 2, Steve Brown.
Yeah, I have a question about our capability. It looks like, and my math could be off, so I apologize in advance if it is, but it looks like we're capable or seem to be producing from the public health lab about 50 test results a day. If there was not a restriction on the material, if you had plenty of reagents, plenty of kits, plenty of personal protective gear, plenty of locations to safely collect the swabs, do we have an idea of what our capability would be?
Well, what we're looking at right now is a community capability. So our public health lab is running between 80 and 100 tests a day right now.
Because remember, we're still testing for other counties,
right,
Niagara, Chautauqua, Cattaraugus. And it's one of the reasons why our numbers are probably lower than Monroe's. We were testing for Monroe originally, and now it's my understanding that Rochester General is testing primarily all for Monroe. So one of the advantages of having a local public health lab is we can do it here. One of the disadvantages is we end up doing it also for the other counties because New York State asks us to do that.
Right, so we're doing our tests and additional counties. So we don't report out the results to the media because we don't our EPIC staff don't get results from other counties. We have heard that that Kaleida Health is coming on board very shortly, and they will increase testing capacity in our community. And we're hoping that the other hospital laboratories in the community will also come on board soon. And so that, again, will be able to increase the testing capacity in our community. I think where we're all stuck right now is, in addition to trying to find reagent, is trying to find specimen collection kits to collect the specimens to do this viral testing. So even if we, could run all the labs we wanted to, we're still at a bottleneck with the specimen collection kits.
With regards to the local labs, right now the only local lab that is doing testing is the Erie County Public Health Lab. If things go as I hope they will this week, you will not only have, as the doctor noted, Kaleida, you will also have Catholic Health, and they believe, depending on the test, they'd be able to do hundreds a day. ECMC the same, as well as Roswell Park. So it's arguable that if we get the materials, and these labs, which are ready and waiting to do it, but they just don't have the materials either, can get the materials, we could be doing thousands and thousands of tests a week. They just don't have the materials. New York State hasn't sent it to them. I'm not happy about it. I'm on the phone talking to my friends in the state, and I'm also hearing the same thing from my colleagues elsewhere in New York State as well as elsewhere in the country. Right now, I think we have less cases identified than Allegheny County, not Allegheny County, New York, Allegheny County, Pennsylvania, where Pittsburgh is. And I'm hearing from the folks in Pittsburgh it's the same thing, even though that's a bigger county with more densely populated people in Pittsburgh. They actually have less. Last I saw, they were at 40 reported cases, and I doubt that. I doubt they're much higher, but they're in the same boat. They don't have the ability to get the test kits and the reagents because of what is a national shortage. Going back, Mike Baggerman, do you have another question?
Yes, you had mentioned that the state would ask you to provide tests for other counties. Do you have the option to say, no, I'm going to focus just on Erie County residents?
We have reduced the number of out-of-county tests that are being done. So based on the priority, if there's an individual in healthcare, law enforcement, that is from one of these other counties because of the potential risk that it is of spread, we are testing those individuals, but we're not testing just everyone that they want. We've stopped that. But we are taking some tests, and I've ordered that some tests be taken from these other counties, but we're not doing all of them that we said. We had the New York State wanted us to test, I won't say which county, but 25 individuals associated with one individual in another county, and I was just, no, we can't. We need to be able to do these tests here for our people. Otherwise, they're going to basically limit what Erie County was able to do for our Erie County residents, and that's not fair. So I have had to make those decisions. And said to the state, if you want those tests done, drive them out to Wadsworth Lab in Albany. We're not going to be able to do them here. So you can imagine I'm not always the best friend of everyone in state government right now because I've had the temerity to say no occasionally. Sandy?
Yes, previously you guys have been very good about releasing for the positive cases gender and age ranges along with the dates when these people were found to test positive, but you have not been releasing them recently. Is it possible for you guys to publicly release that information for all of the confirmed cases? We are interested to know, and we are keeping a database of folks, and are interested to see if there are any patterns by age, for instance.
Well, ages, we're going to try to continue to do that. A lot of this has just been the workload on the epidemiologists. The locations where they've been, it's increasing so much, that's why we're telling everyone, assume it's been everywhere. Previously, we'd know to
right,
Walmart.
We have.
I know, Miss Andy, but it's probably been everywhere. And we are not able at this point to continue to inform of every contact trace associated with each individual that's tested positive.
Right, we're not expecting that. I was just curious about the gender and age range. We've made past requests for this information, just still not gotten it. So
Yeah.
just wondering if that would be coming out.
Yeah, I mean, just the number of new cases a day is just ballooning, and we're just, our priority is to make sure that those individuals are informed of their test results, make sure that these contacts are informed about their exposure, and that people take the appropriate actions to be in isolation and quarantine. And that's where we're really focusing our efforts, on the people that we know are true cases and the people that we know are very close exposures, like people in the household or very close contacts, like partners. So really, that's where we're focusing our efforts. And I know it's nice to know information about age and gender, and honestly, that's not going to change what we need to do in Erie County to protect ourselves. I think we have to assume that it's everywhere. And these, again, is really a very small portion, a small piece of the pie, the tip of the iceberg of all the people in the community that are infected. So these are the people that were able to come to us to get testing. So we don't even know if it's reflective of the demographics in our community that are truly positive, because we haven't tested them. If you don't have a test, you don't have a positive test. And so, again, we're just trying to inform people that the numbers are escalating at a very fast rate, and then people have to take the appropriate actions.
This will be the last round of questions. These number here, because we've got to run. But Channel 7, Ellie Tui.
Yeah, I'm just curious if you guys have had any word on any fatal cases, and also just to follow up on Sandy's question, though, about the priority of who gets tested, the priority, I should say, of, what would give Mr. Poloncarz a test over myself, for example? What kind of, how are you rating those?
Well, the fatalities, I'm glad to say, are still 0. We've confirmed that. There are no individuals that we are aware of that have died in Erie County from COVID-19. And I'll let the doctor finish.
Right, who have a known positive test. And then just in terms of our priorities for testing, we are really trying to focus now on people working in the healthcare field that could have infected other people. They could have been working while they're contagious. Also, we want to make sure that we keep our numbers up of people able to work in the community in our healthcare field. So that's why they're important to test. If they're COVID negative, then the time that they have out may not be as long as otherwise. So again, we're also trying to test hospitalized patients, just so we can also get a better idea know what to expect with their hospital course, and also know if they have to be in a specific negative pressure isolation, if that is available. And then again, we're hoping in a couple weeks' time to be able to have a specific hospital that is designated for all patients that are test positive for COVID-19, and so we'll be able to remove them away from the rest of the hospital patients and the hospital healthcare workers into one location, so to decrease the risk of exposure. Also, essential people that we need to test, could include first responders or other essential staff. But right now, what we're really trying to do is focus on people in the healthcare community.
Sarah Minkowitz from Channel 4, are you still there with one more question?
I'm still here, but I'm all set. Thank you.
Okay. Steve Brown, are you still there with Channel 2 with one more question?
Yeah, I do. Should people be bracing themselves for a rapid jump up in positive tests? It seems logical that when you get more labs online, when you get more materials, that people should be bracing for and not be surprised by the number of cases that jump up, or even perhaps the number of fatalities that jump up, because you can now test folks that may have passed.
Yes.
And this is what we've seen nationally and internationally. This is what we can expect from COVID-19. So we see, a pretty steep rise in the epi curve of number of new cases until we reach a peak, and then we'll see a decline. And then, we'll have to see if we have, as time marches on and we kind of lift the travel restrictions and contact restrictions, there could be in a situation where we have another spike. So, again, this is going to be kind of the new normal for a while.
as we've reported with some of the initial contacts, we know they date back more than 2 weeks ago. We know that individuals were out in the community who we now can confirm are positive, but they were out doing business while they were symptomatic. That's why we're saying it's everywhere. You might not see your town on that map, but it's there. And once we get a positive from it, your town will turn to red. City of Tonawanda on the top will turn to red. We know it's probably there. We just don't have a positive case yet. So we are expecting, when we're able, and with our partners, like the 4 labs I talked about earlier, the 3 hospitals and the Roswell Park Cancer Institute, are able to do testing, we're expecting the numbers to jump for not just Erie County, but all of Western New York. I haven't seen the latest from Southern Ontario, but I've heard those numbers have generally been going up as well, because it's going up everywhere. There was a time when there were states that didn't have cases. They all have cases now, and it'll continue. If to the reporters, if you still have additional questions, Dan Meyer is here. Please send them to Dan or Kara Kane from the Erie County Department of Health, the ones that are specific for the health department. We will try to, at least once a week, Sandra, as we update the cases by the ages and the female-male gender. But there is a lot of work that's going on. We had to separate some of our teams, not because of illness issues, but because it was just too busy. It was too noisy, so we moved some of the folks from the Department of Health that normally work on 9 to a different floor.
And we have to practice what we preach with
Yes.
social distancing.
Yes, so we had to just move them around, so that happened 2 nights ago. I want to thank our friend from Deaf Access Services. We were supposed to have 2 of them here. We have one. Please introduce yourself for everyone at home.
Hi, I'm Jennifer Weisel.
Thank you, Jennifer, for your good work. Yeah, you did double duty today. This will be our only press briefing today, as we've done in the past. If we have updates with regards to positive cases, and there's still tests that are being run right now, they will be updated through the COVID map. We've been lucky. We don't have any deaths. Let's hope that keeps going. And as soon as we have recovereds that we know are definitely recovered, those will be added as well, so people can see that you actually can live through this illness. With that, take care of everyone, and I'll talk to you soon. And maybe you'll catch me singing a song sometime. Bye.